Dear Plus Plus ambassadors, welcome to the product training of LayerCare. What is the indication for prescribing LayerCare? Firstly, for confirmed and suspected cases of endometriosis, endometriosis-associated pelvic pain, secondary dysmenorrhea, adenomyosis, endometrioma or chocolate cysts, extragenital endometriosis, and secondly, for pre- and post-surgery of endometriosis. Let's understand what is endometriosis. If the tissue that is normally inside the uterus, also known as endometrial tissue, grows outside of the uterine cavity, it's termed as endometriosis. This is an estrogen-dependent disease. Retrograde menstruation is the major theory to explain endometriosis. What are the typical symptoms of endometriosis? Painful menstrual periods or dysmenorrhea, non-menstrual pelvic pain, pain during or after sexual intercourse or dyspareunia, painful urination or dysuria, pain while emptying bowel dysphagia, painful rectal bleeding or blood in the urine, also known as hematuria, cyclical lung problems or pneumothorax, cyclical cough or coughing of blood, called hematisis, cyclical scar swelling and pain, fatigue, infertility, or any other cyclical symptom.
Endometriosis. Endometriosis is a condition in which endometrial tissue gets deposited in areas other than the endometrial lining of the uterus. The reproductive system is made up of the vagina, uterus, fallopian tubes, and ovaries. During normal menstruation, the endometrial lining of the uterus is thickened by hormones secreted by the ovaries in order to allow it to be ready to receive the fertilized egg. If the egg is not fertilized, the uterus sheds the endometrial lining into the vagina through a process known as menstruation. In the case of endometriosis, the misplaced endometrial tissue outside the uterus is also stimulated by the hormones from the ovary and thickens. This extrauterine endometrial tissue is also shed during menstruation, but cannot be eliminated from the body and is therefore trapped, resulting in inflammation and pain in the surrounding regions. This could result in adhesions or scar tissue forming between organ structures and constriction of the fallopian tube, resulting in infertility. Endometriomas or chocolate cysts could also form because of endometriosis. These are fluid-filled sacs in the ovaries, which could also cause infertility in the patient. Abnormal bleeding is another consequence of endometriosis. Common sites for endometriosis to occur include ovaries, fallopian tubes, outside of the uterus, supporting structures around the uterus, peritoneal lining of the pelvis. Other sites could also include bladder, rectum, intestines. Treatment for endometriosis includes the following: use of pain medication such as acetaminophen and NSAIDs, hormonal therapy with birth control pills which prevent monthly endometrial buildup and bleeding, surgery to remove endometrial tissue, adhesions, cysts, or nerve fibers which relay pain, or a hysterectomy or an oophorectomy.
Market size for treatment of endometriosis. 1 in 10 women get affected by endometriosis during their reproductive years. 68% of women with endometriosis are initially misdiagnosed with another condition. This means that there are a huge number of patients of suspected cases of endometriosis. 82% of women are at times unable to carry out day-to-day activities due to endometriosis. What is the need of the patient? Safe medication for both suspected and confirmed cases of endometriosis. Endometriosis and related symptoms can severely affect the quality of life. If left untreated, it can even spread beyond the pelvic area and harm a woman's GI tract. However, it can take years to confirm the disease. At present, treatment is usually aimed at controlling symptoms. There is a need for safe medication that ensures effective prevention and better management of the disease in both suspected and confirmed cases of endometriosis. Let's look at the current prescription practice and its gaps. There are 3 treatment options for endometriosis. Invasive surgical options, non-invasive, that is a medical option, and combination option, where medical option is used before and after surgery. There are 5 primary non-invasive options: oral contraceptive pills, agonists, NSAIDs, androgens and progestins. OX suppress FSH and LH hormones and provide pain relief, but they also create estrogenic side effects, nausea, weight gain, water retention, and increased thromboembolic risk. Agonists, like OX, also suppress FSH and LH hormones, provide pain relief, but they create menopause-like symptoms and reduce bone mineral density or BMD in patients. NSAID is a non-specific treatment. It provides pain relief but creates nausea, vomiting, and stomach ulcers in the long run. Androgens provide pain relief. They inhibit LH and FSH. However, they are hypoestrogenic and have androgen-induced side effects like hair loss, acne, etc. Progestins should be the first choice of treatment. They suppress ovarian activity and inhibit endometriotic lesion growth. They work on the root cause, not just the symptoms. However, in high dose, they create weight gain and androgenic side effects. They elevate the risk of cardiovascular adverse events and depression. So, what is the solution? And is there any competition in the market? The ideal solution is to provide low-dose progestin. It is safe, with minimal adverse effect, and has the capability of management of hormone level and inflammation. There are many competitors in the Indian market with low-dose progestin. It is available in the form of molecule, Dienogest 2 mg. This table shows some of the common brands available in the market. There is another kind of direct competitor, combination of Dienogest with ethinyl estradiol. It's important to understand that Dienogest is used for the treatment of endometriosis as monotherapy. Dienogest in combination with ethinyl estradiol is primarily used as a contraceptive. In fact, in Europe, Australia, Malaysia, Singapore and Japan, Dienogest single therapy is the only approved treatment for endometriosis. Here is a table showing indirect competitors in the form of OX, GnRH, androgens, and other types of progestins. Plus Life Sciences introduces LayerCare for suspected and confirmed cases of endometriosis. It contains Dienogest 2 mg. LayerCare, care for endometrial layer. So, what is Dienogest? Dienogest is an orally active, semi-synthetic, 4th-generation progestin. It is used in a very low dose of 2 mg once daily. It has anti-proliferative, anti-inflammatory and anti-angiogenic properties. As per IS or European Society of Human Reproduction and Embryology, Dienogest is the first-line treatment for endometriosis. Extensive clinical trials have been done for safety and efficacy of Dienogest. How does Dienogest work? Dienogest has a twofold action. It stops new lesions from getting formed. and it slowly reduces the existing lesions within the ovary. It inhibits the growth of follicles at 10 millimeters. As a result, estrogen levels reduce, but basal levels are maintained. It's the growing follicles which release estrogen. Estrogen is responsible for the growth of endometrium. Once basal levels are maintained, endometrium lining does not grow, and therefore more lesions are not formed. It's important to note that follicle growth inhibition causes anovulation or a condition when the egg or ovum is not released from the ovary during the cycle, causing temporary infertility. Dienogest also works on existing endometrial lesions. It destroys or interferes with the fine network of blood vessels and stops the formation of new blood vessels, thereby reducing lesions with time. It further reduces inflammation and pain. Thus, Dienogest has the following 3 properties. 1. Anti-proliferative, or the ability to stop the growth of cells. This means that it does not allow cells to multiply rapidly. 2. Anti-inflammatory, or the property to reduce swelling or inflammation and pain. And 3rd, anti-angiogenic, or the property to destroy or interfere with the fine network of blood vessels and stop formation of new blood vessels. Once again, Dienogest is anti-proliferative, anti-inflammatory, and anti-angiogenic. Packaging of LayerCare. LayerCare comes in the form of uncoated tablets. Each strip has 10 tablets. The carton is yellow, with a mark of yellow ribbon. Around the world, yellow ribbon stands for endometriosis. Manufacturing. LayerCare is manufactured by Akums Drugs and Pharmaceutical Limited. They are one of the best manufacturers of Dienogest in the country. Their manufacturing unit is dedicated for hormonal formulation. It is WHO, GMP certified, GLP certified, and ISO certified. Thus, LayerCare gives the promise of highest quality and efficacy. It has 1 year and 11 months expiry. Cost of LayerCare. See this table for PTS, PTR, and MRP of LayerCare. Finally, what are the benefits to patients once they start their therapy with LayerCare? LayerCare has 3 main patient benefits. 1. It works on the root cause and provides symptomatic relief. How? Reduces endometriotic lesion size. Effective in deep infiltrating endometriosis. Effective for endometriosis-associated cyclic pain. Better for adenomyosis treatment as compared to COX. Second, it is safe. Can be taken even in suspected case of endometriosis. It can be taken for 5 years continuously. And it is devoid of hypoestrogenic side effects. Third, it provides quick recovery of fertility. Compared to OPS, Dienogest restores fertility within 45 days post-cessation of therapy. What will be your unique selling points to the customer? Dienogest is first-line treatment for suspected as well as confirmed cases of endometriosis. It has anti-proliferative, anti-inflammatory, and anti-angiogenic properties. Also prescribed for pre- and post-surgery management of endometriosis. It can be prescribed for 5 years continuously. Fertility treatment can be started within 45 days of post-cessation of therapy. Most importantly, LayerCare is manufactured in dedicated hormonal formulation plant, which is WHO GMP certified. It is of highest quality and efficacy. Facts that the doctor must be made aware of. Dienogest can be taken at any day of menstrual cycle. It should be continued regardless of vaginal bleeding. It has no glucocorticoid activity and CVD risk. Resistant not observed. The metabolites are pharmacologically inactive and rapidly eliminated from the plasma. Friends, LayerCare in a nutshell. LayerCare, Dienogest 2 mg. Care for endometrial layer. LayerCare should be prescribed in case of suspected as well as confirmed case of endometriosis. Indications include endometriosis-associated pelvic pain, secondary dysmenorrhea, adenomyosis, endometrioma or chocolate cysts, extragenital endometriosis, and pre- and post-endometriosis surgical procedure. 1 in 10 women have endometriosis. However, if suspected cases are included, there is a larger need for LayerCare. Unlike other molecules like OPS, GnRH, etc., Dienogest reduces root cause of endometriosis as well as provides symptomatic relief. It is completely safe and can be taken continuously for up to 5 years. It can restore fertility within 45 days post-cessation of therapy. LayerCare is first-line treatment as Paris. It has anti-proliferative, anti-inflammatory and anti-angiogenic properties. It comes with highest quality and efficacy. Manufactured in dedicated hormonal formulation plant, which is WHO GMP certified. Dosage 1 tablet per day. Cost of therapy is 54 rupees per day. Even though expensive as compared to OPS and other methods, it is the OBLI treatment which works on the root cause. Dear doctor, prescribe LayerCare Dienogest 2 mg to suspected as well as confirmed cases of endometriosis. Also prescribed during pre- and post-surgery management of endometriosis. Thank you for your patience and time. Remember, LayerCare is not a unique molecule in the market, but it's made with highest quality standards. And, with your in-depth knowledge and understanding, you can reach out to even suspected cases of endometriosis.